Welcome back to the Quantum Leap, charting the next decade of medicine. I'm your host, Dr. Nirdosh Jagota. In our previous episodes, we've explored how artificial intelligence is discovering novel targets, designing new molecules, and even automating the physical chemistry lab. We've seen AI act as a powerful tool, a calculator, a pattern finder, an optimizer. But today we are crossing a threshold. We are moving from AI as a tool to AI as a colleague. Today we are talking about the new AI scientist. We are going to explore how large language models, reinforcement learning, and autonomous agents are fundamentally reinventing research and development. We are entering an era where AI doesn't just answer our questions, it asks its own. Let's start by looking at the scale of the problem we face in modern biology. Every single year, over 3 million biomedical papers are published on PubMed alone. The total corpus of biomedical literature now exceeds 36 million papers. It is physically impossible for any human researcher or even an entire team of researchers to read, comprehend, and synthesize more than a tiny fraction of this information. As a result, critical cross-disciplinary insights are frequently missed. A breakthrough in oncology might hold the key to a neurodegenerative disease. But if the right researchers don't read the right papers, that connection remains hidden in the data. This is where large language models, or LLMs, enter the picture. You are likely familiar with general-purpose models like ChatGPT or Gemini. But in the pharmaceutical world, we are seeing the rise of domain-specific models. Take Biomed for example, a 2.7 billion parameter model developed by Stanford researchers, trained exclusively on PubMed abstracts and full biomedical articles. These specialized models are not just searching for keywords, they are understanding context, extracting biological hypotheses, and identifying hidden pathways. They are doing the work of 1,000 literature reviews in a matter of seconds. They are synthesizing decades of scientific knowledge to propose novel therapeutic targets that human researchers simply overlooked. But literature mining is just the beginning. The real paradigm shift is the transition from language models to autonomous scientific agents. What is an autonomous agent? Unlike a traditional AI model that performs a single specific task, like predicting a protein structure, an autonomous agent can perform multi-step reasoning. It can use tools, it can plan, self-correct, and iteratively improve. Consider the recent breakthrough announced by Google Research in February 2025, the AI co-scientist. Built on their Gemini 2.0 architecture, this is a multi-agent system designed to mirror the scientific method itself. It uses a coalition of specialized agents, one for generating hypotheses, one for reflecting on them, one for ranking them, and another for evolving them through a process of scientific debate. And it works. When tasked with finding drug repurposing opportunities for acute myeloid leukemia, the AI co-scientist proposed novel candidates that were subsequently validated in the lab, successfully inhibiting tumor viability. When tasked with explaining mechanisms of antimicrobial resistance, it independently deduced a complex biological interaction that human researchers had only just discovered in the lab, but hadn't yet published. This brings us to the concept of reinforcement learning in drug discovery. Imagine you are trying to design a new molecule. You don't just need it to bind to a target, you need it to be soluble, non-toxic, synthesizable, and capable of crossing the blood-brain barrier. It is a massive multi-objective optimization problem. Reinforcement learning agents tackle this by treating molecular design like a game. The agent makes modifications to a chemical structure, adding an atom here, changing a bond there. It is then rewarded based on how well the new molecule meets all those complex criteria. Through millions of iterations, the agent learns which chemical modifications lead to the best drug candidates. But what happens when you combine these capabilities? What happens when you combine the literature mining power of an LLM, the optimization power of reinforcement learning, and the physical execution of a self-driving lab? You get fully automated research. In March 2026, the AI research company Sakana AI, in collaboration with the University of Oxford and others, published a landmark paper in the journal Nature. They introduced the AI Scientist, the first comprehensive system for fully automatic scientific discovery. Given a broad research direction, this system autonomously generated novel research ideas, read the relevant literature, designed and programmed the experiments, executed them, and then wrote the entire scientific paper, complete with figures. When submitted to a rigorous human peer review process, the AI-generated paper actually surpassed the average human acceptance threshold. We are also seeing this applied directly to biology. Consider Robin, a multi-agent system published in Nature in May 2026. Robin was the first system to fully automate both hypothesis generation and data analysis for experimental biology. When applied to macular degeneration, a major cause of blindness, Robin autonomously proposed a novel therapeutic strategy, identified 2 drug candidates, and then proposed follow-up experiments to uncover new targets. Every hypothesis, every experimental direction, and every data figure in the paper was produced by the AI. This is the frontier. We are seeing massive investments in this space. Just recently, Flagship Pioneering unveiled Leela Sciences, backed by $200 million in seed funding with the explicit goal of building a scientific superintelligence platform. Their operating system is designed to execute the entire scientific method autonomously. So what does this mean for the future of the human researcher? It does not mean the end of human scientists, but it does mean the end of science as we have known it. The researchers of the next decade will not spend their days pipetting liquids or reading endless stacks of papers. They will be directors of scientific strategy. They will guide these autonomous agents, setting the goals, defining the constraints, and interpreting the highest level results. We are moving from an era where we use AI to do our work to an era where we manage AI to expand the very boundaries of what is possible. Thank you for joining me on this episode of The Quantum Leap. I'm Dr. Nirdosh Jagota. Next time, we'll dive into the quantum realm, exploring how quantum computing is poised to become the ultimate catalyst for this AI revolution. Until then, keep looking to the future.